Pertussis is a respiratory infection that we're a little less common with now due to the high vaccination rates that we have. So it's provided in the Tdap vaccine that also has tetanus and diphtheria. Recently, we've seen cases rise in the Morgantown area and the surrounding counties of pertussis. And it's usually identified by a lower respiratory infection that has a very violent, powerful cough that will keep you up at night, can affect breathing, and even cause vomiting episodes. In these cases, it seems that the cough isn't going away and it tends to get worse instead of better. Pertussis is spread through respiratory secretions, so coughing, being in close proximity to others. And so again, it's better to stay at home if you're experiencing symptoms, wear a mask or wash your hands. It is most contagious if you do have pertussis for those family and friend close contacts. So any roommates or close friends that you see on a regular basis, anyone that you share housing with would be at the highest risk. Yeah, so anytime that we start seeing spikes in any of our illnesses, we become concerned for the community, because for areas that there's large group gatherings or a lot of people in close contact, especially during the winter when everyone's indoors, respiratory illnesses can spread rapidly. So because this is an illness that can last for weeks and produce more severe complications such as pneumonia and vomiting and leading to hospitalizations, we try to protect others from the spread when we can. So it's best to identify it, get treated, and also treat your close contacts. So for anyone whose cough has lasted for a long time, they're feeling worse instead of better, experiencing a violent cough or having vomiting with their cough, they should be evaluated in clinic. We do have an easy nasal swab that we can perform to test for pertussis that comes back within a day's time. And after that, we provide treatment and we'll also treat close contacts. Yes, so most people obtain a childhood series of shots and then a Tdap at age 11 or 12. So for most college students, they're falling into that range where they're due for a booster in 10 years, which is around age 21. So for anyone who hasn't had that updated, they can easily walk into Student Health for an update. For some students, they may have had this update if they experienced an injury or had stitches, because we usually do update it in those cases for the tetanus portion.